Now we'll be proceeding to the next session. It will be a debate. Before that, we have an announcement.
Many of the experts from CMC Vellore, All Indian Institute of Medical Science, Delhi, they are coming. So, especially for the postgraduate, there are a lot of interaction, many pictures, oriented clinical presentation, and I think very interactive session and quiz contest with a huge prize. Please, my appeal to the all postgraduates, please, outside there is a registration counter. You can register for next Sunday at Dhanodhan, the new auditorium. We will be organizing this thing. Thank you.
I have another announcement. We have AsthmaCon on 5th and 6th of August in Suresh Neotia Hall. For today, the registration prices have been kept 1,000, including the workshop and conference. Please register.
So, and there is another announcement from my side. So, first time here in the Eastern Zone, we are organizing the National Conference of the Simulation at AIIMS Kollani on September 23rd, 24th, and there will be Faculty Development Program on the 25th and 26th. So, this will be opportunity because this is happening first time in the Eastern Zone. So, you can register for the simulation, Simulus 8, it will be in the AIIMS Kollani.
Now we move on to the next session. I'd like to call upon stage Professor Dr. Shubhashish Bhattacharya sir to please chair this session. He is the HOD and Professor, Department of Pediatrics, Chittaranjan Shishu College of Obstetrics, Gynecology and Child Health under Government of West Bengal, Kolkata. I'd like to request him to welcome and introduce the speakers. We have Dr. Somnath Goren to speak for the motion and Dr. Kaustubh Choudhury to speak against the motion. And our topic is albumin in dengue shock syndrome. Each will speak for 7 minutes, for 2 minutes rebuttal and 2 minutes for summarization. So, hand over the dais to sir.
Thank you and welcome everybody, and I must thank organizer and especially Dr. Professor Mihi Sarkar for inviting me in this gathering, in this learned gathering I should say, and the very unique topic is given to us, and two of our experts are there. I will be shortly I will be introducing them, and the topic is albumin therapy. Is there? They will the specialists, pediatric intensive care specialists, they will highlight the against and in favor of the using albumin therapy. We know that albumin, yes, it is a colloid, is a very important protein present in our system, and there are many recent study coming that the albumin is responsible for vascular integrity, vascular permeability, and maintaining of the glycocalypse of the endothelial cell. In dengue, it is severely damaged, and there is a possibility of leak is there, plasma leak, and that lead to hypovolemia and all sort of complication in dengue, hemorrhagic fever, and dengue shock syndrome. Where there is indication, definitely there is some controversy. Every medical this thing intervention you consider, there is a controversy. Some say against, some say in favor. So definitely at the end of our session, we'll reach to a consensus that what should be done. For this deliberation in against and in favor, I welcome and invite Dr. Kaustubh Choudhury. He is a very energetic and enthusiastic pediatric intensive care specialist associated with Apollo Hospital. His area of interest is ECMO, pediatric infectious disease, hemodynamics, advanced ventilation, and cardiac and renal transplantation patient. And he also reviewer of many index journal like PIJ, D and Indian Pediatrics and Indian Journal of Pediatrics like that. And he presently associated with DNV and is DNV examiner in the recent time. And also I am inviting Dr. Somnath Goren. Is actually presently associated with pediatric intensivist at the PICU in charge of Bhagirathi Neotia Women and Child Care Center, Newtown. His area of interest is infectious disease in PICU, pediatric cardiac critical care, and non-invasive monitoring in PICU. Thank you.
Very good afternoon and thank you, sir. Today we are going to discuss about albumin in dengue shock syndrome, and we all know that dengue shock syndrome is a nightmare for all of those intensivists, those who are practicing. Let us discuss a bit. So severe dengue with shock, definitely with a high mortality, it can be as high as 44 to 72%. And major contributor of this mortality, obviously capillary leak with huge fluid overload or malignant fluid overload with increased intra-abdominal pressure, ARDS, etc. So, but problem is that dengue we have to treat with fluid, we have to play with fluid. So obviously this is a double-edged sword. So what are the options we have? So after initial, any patient coming to the PICU after initial fluid boluses, what we can do, we can repeat the crystalloid boluses with increase the fluid rate with whichever he was going, or we can try synthetic colloids like dextran, HES or gelatin, or we can try albumin, that is either 5% or 20% or FFP. So ideal and perfect fluid for DSS, is there any? So what will be the ideal perfect? Obviously rapidly expand the intravascular volume that should remain inside the intravascular space for longer time. The minimal adverse effect should be physiological, is cost effective, is availability and evidences should be there to back this up. So as we all know that one of the basic rules of the universe is nothing is perfect. Perfection simply doesn't exist. Without imperfection, neither you are nor would I exist. But we should try which is near perfect things. So can albumin fulfill our expectation, either pathophysiological or pharmacological, or what are the evidences for that? So what are the albumin characteristics? Albumin is derived of human derived colloid, which larger molecule. It can exert an oncotic effect to draw water from the EGL, that is endothelial glycocalyx, about 700 ml back into the free flowing plasma. It increases free flowing plasma volume by more than the volume of the fluid infused, and its potential to restore structural and functional characteristics of endothelial glycocalyx. And both 5% and 20% can be used. Restoring glycocalyx is the new concept that is based on the revised Starling's criteria, and we all know that in this paper published in 2019, they explained in details about the dengue shock syndrome with glycocalyx and fluid management in dengue shock syndrome. They shows that the low protein environment has long been a recognized cause of rapid breakdown, shedding of the endothelial glycocalyx. Plasma and albumin both helps in preserving and restoring the endothelial glycocalyx, reducing vascular permeability and reducing the platelet and leukocyte adhesion in preclinical studies. And albumin transfusion alters the selective permeability of the endothelial barriers, reducing outward flux, permitting the low hydrostatic pressure of the capillaries to rise also. So what about the adverse effects? And we can compare with the different adverse effects of those fluids I have discussed earlier, the optional fluid. So we can see that human albumin has lowest risk for electrolyte disorder, acid weight disorder, coagulation disorder or bleeding risk, and acute kidney injury. Albumin has low risk and as compared to the other colloids as well as crystalloids. So let's go through some studies. So this is the comparison of 3 fluid solution for resuscitation of dengue shock syndrome. It was published in 2005, and they shows that conclude that the initial resuscitation with Ringel's lactate indicated for children with moderately severe dengue shock syndrome. Maintenance with crystalloid resulted in less rapid improvement in the hematocrit and the marginally longer time to initial recovery than did treatment with either of the colloid solution. Choice of fluid for the resuscitation of children with severe infection and shock. The systematic review published in 2010, they conclude that volume expansion with human albumin solution or other colloids should be better than the crystalloids in specific groups of patients with diverse morbidities like dengue, sepsis and malaria. Colloids control shock for a longer period and duration is less, need for other rescue treatment other than the Ringer's lactate. This is another thing, another publication in 2023, that is dengue update, clinically relevant therapeutic strategies of and vaccines. So they conclude that in case of profound shock with patients have pulse pressure less than 10 millimeter mercury, colloids are preferred since they have been shown to restore the cardiac index and hematocrit more rapidly than the crystalloid. Now albumin versus other colloids. So this is publication in 2009 from Indian Journal of Anesthesia. They already I told that compare with the other colloids. So albumin being natural colloids is less side effects like pruritus, coagulation disorder, anaphylactic reactions are less in albumin and causes more volume expansion than dextran or HES. This is another publication from Dr. Sujita Ranjit and their team, and they basically did a targeted intervention in critically ill children with severe dengue, and for those sick patients they use the albumin rescue therapy. So they give 1 gram per kg albumin over 6 hours for critically ill children and targeted. They saw that the outcome is better in albumin group. So consecutive patients 2 months to 16 years severe dengue admitted in 10-bed PICU between they found they gave 4% gelatin, albumin was transfused after standard treatment in 2 groups. This group receiving albumin showed significant reduction in the volume overload, peri-intubation, cardiorespiratory decompensation, better control of shock led to lower incidence of major hemorrhage. The incidence of AKI was also lower in the group receiving albumin. Overall, PSU days and mortality were significantly reduced in the albumin group. Now, cost and availability. Obviously, albumin is a bit costlier than other fluids, but it is easily available. But if you comparison the PICU stay, even 1 or 2 days extra PICU stay, if you use the other fluids, the cost will be huge. There will be a huge difference in the cost. And latest guideline from CDC published in 2019 also, they even hypotensive shock with dengue, they gave isotonic crystalloid or colloid. Here or colloid is there, and repeated boluses of colloids they recommended. So conclude my talk that severe dengue with shock is high mortality and proper fluid management changes the outcome. Albumin is a natural colloid, so less adverse effect. Albumin supports the glycocalyx. Greater volume of expansion is there, antioxidant and scavenging property is also there, and there are several evidences to support those facts, and obviously we all have experience with albumin. So albumin is I know double-edged sword, but if you use it properly, it's just like a robot. It should not turn around against you, but definitely will help us and conquer the dengue shock syndrome. Thank you.
Thank you. Now I invite Dr. Kaustubh Chaudhary against the use of albumin, or not in favor of using albumin in dengue shock syndrome.
Thank you, sir, for kind introduction, and well done, Somnath, for giving an overview of albumin use. But I just changed the topic by writing that should colloid boluses be prioritized over crystalloid boluses, particularly for the management of dengue shock syndrome in the presence of ascites and pleural effusions. So when you are talking about dengue shock syndrome, are you talking about giving albumin to all patients of dengue shock syndrome? But if you see the evidence, possibly you are talking about mostly the severe dengue shock syndrome rather than for the all. So what actually leads to this severe dengue shock syndrome? Let's see. So so far we mostly follow the WHO guidelines, and that gives an idea that PCB and hemoglobin levels is the main criteria to target your fluid management. And recommended fluid is still like isotonic fluid to start with, that is isotonic crystallized like normal saline and ringal lactate. And usually in non-responders you can go for colloids, and that is something like dextran or albumin. Now, if you go through that WHO, how it approaches that, when they found that in dengue epidemic in Sri Lanka and got lots of cases of death in dengue shock syndrome, what they found as a cause is actually the injudicious use of fluid. So whether you are using colloid or crystalloid, if you are not judicious about, then you will obviously turn up into severe dengue shock syndrome and actually causes the more harm. So it is a judicious use of fluid that is most important. Whether you are using crystalloid or colloid, that doesn't matter. Apart from that, there is myocarditis related cardiac failure and acute hepatic failure. When there is a fluid leakage, because dengue shock syndrome, we are always talking about that this fluid leakage and then third spacing and all this. But why this fluid leakage happens? It is not necessarily only the albumin is the sole factor. So there are lots of factors which actually damages the glycocalyx or the endothelium wall. And there are something like uncorrected hypoglycemia, lactic acidosis, obviously low serum calcium, and administration of either IV or oral, particularly hypotonic fluids. Even if you are giving oral fluid, that also is dangerous. And don't forget that infection part. Albumin is a small chunk. And if you go through the pathophysiology of dengue shock syndrome, it's basically, if you're talking about most infections, the permeability factor in the severe sepsis or severe dengue shock syndrome is almost similar. But having said that, there is some difference of that this is transient in nature. So if you are early in detecting and proper fluid management, possibly it will be reversed within some hours or some time, some day. It is not like in septic shock, like a prolonged period. Therefore, patients who develop third space fluid loss very likely to be risk of rapid circulatory overload, and you have to detect it and treat it early. So far, if you are really looking for the RCTs, when we are talking about albumin and this crystalloid, unfortunately there is not much. So whatever we are extrapolating for the colloids and crystalloids, and colloids mostly this dextran and all this. So when there is such, and one RCT was found, and that shows some advantages of colloids, but that is, there is no clear advantages to using these four liquids like dextran, gelatin, ringal lactate and normosaline. And most significant factors during that clinical response was that pulse pressure. So that is what Dr. Somnath has shown already. And when they plan to look for that, almost in the Vietnamese patient in WHO, they found that there is no difference, particularly whether you use crystalloid or colloid, in the need for ventilation. Because most of the time when you are thinking of that, there is increased permeability, you are mostly thinking of that respiratory compromise, and that's how the ventilation requirement is there, but it is not so. And only one double-blind randomized controlled trial when they did with by Wills et al., that also shows that there is no significant difference in the development of all these factors like bleeding manifestations, clinical fluid overload, objective measures of the overall severity of the volume leakage, or the use, even the use of furosemide, whether it is resuscitated with crystalloid or colloid. And the findings also suggest that there is these effects of colloids, if you are giving it, it is for a short period, it is not lasting for a longer period. And even if it is severe shock, and only the severe shock part, that is dengue shock syndrome with the severity, severe part, they are actually responsive. So for those severe shock patients, possibly the situation is still less clear cut, and it's the clinician's prerogative as well as the cost and all these issues that they can consider, and accordingly they can use albumin over crystalloid, but not for all dengue shock syndrome. So my final messages are quite clear. Use judicious fluid, whether it's crystalloid or colloid. Better to use crystalloid, we are all familiar with and mostly available. Try to prevent DSS rather than exaggerate it. Then classify the severity of DSS, choose fluid wisely, and I think we need a double-blind RCT before saying that albumin is better. But the subset is still in the severe variety of dengue shock syndrome. Thank you.
Thank you, Gustav, for your this presentation to use albumin not in favor, especially in dengue shock syndrome and dengue fever. But clinician, we should maintain the middle pathway. That means, if required, that can be used, or sometime definitely it is contraindicated, we will not use it. There are many studies. I just went through few studies, just came within 2 or 3 years. One from Indonesia, one from India, and one from Brazil. The Brazilian study have identified that probably albumin maintains the integrity of the vascular vascular endothelial, especially in this situation where dengue-like fever or hemorrhagic fever. And they have mentioned if we estimate albumin from the beforehand, we can predict the probably which group of patient will enter into the critical second stage of disease or not. So on this hypothesis or on this basis, the Indonesian study and Indian study from North India, they have shown that the use of albumin judiciously at the beginning, before starting of the critical phase, probably eliminate the chance of fatality, mortality, morbidity, and also decreases the intensive care setting stay. So that is important. So what is your take on this? And definitely we'll come to Kostov.
Definitely, basically Dr. Kostov has answered my questions also, because the whole discussion is dengue shock syndrome. We are not talking about mild dengue or dengue with warning sign. Yes, severe dengue with shock. So obviously we have choices are limited and we have to use it judiciously. Fluid has to be given, but child if present with shock in front of you, options are either you go for colloid like Dextran, HES, or you can go for albumin. So as I told you that those studies, side effects wise, except cost, but all other factors are favorable in dengue, albumin, either 5% or 20%, even evidences are also there. So I think we should not hesitate to use it, but definitely close monitoring, close hemodynamic monitoring is required, and outcome will be definitely better.
Dr. Kostov, please.
So I've never said that we don't use albumin. What I said is when a patient comes to you in emergency, even if it is in dengue shock syndrome, we prefer to start with crystalloid. Even I think you also do like this, and having said that, when we see the response with the crystalloid, then only we are going for more crystalloid. And with crystalloid, if we are getting something like fluid overload or something like leakage, possibly just what we do in the septic shock patients also, if it is not fluid responsive but fluid refractory in the form of crystalloid fluid, possibly that time we are going for colloid fluid like albumin.
The recent CDC guideline 2019 that came, that I told so in this picture, hypotension with dengue, severe dengue, first choice will be colloid or crystalloid, even first choice. Second, definitely colloid, there is no doubt about it. First choice is they have written crystalloid or colloid. So that is.
So again, A followed by B. So crystalloid followed by colloid.
Or.
So to conclude this debate, I think we should maintain that is the judicious use. The important term is the judicious use of the albumin when it is at all required. So thank you very much to our both the doctor. Thank you.